Hi YouTube, it's Nigel here. 3 years on T, 1 year and a month post-op. Just wanted to do a 1 year on post-op video for Dr. Belanger, well, for you, but Dr. Belanger, Maud Belanger in Montreal was my surgeon. I got it at the GRS Clinic that is in Montreal, and that was covered by Ontario Health here in Canada. I posted a few videos earlier, which was just a few weeks in. I don't know, 3 or 4 weeks in. I can't remember. You can watch that, and I just thought I'd show you it a year on. So there's a front view. Here's a side view, actually my better side. Here is the other side. This side is still raised right here. So it could just be, chance. Actually, yeah, I think right there you can still see the red dot where the drain went in. That drain was like this hole, whereas this drain, which I can't even find the scar for anymore, was a slit. So I feel like maybe a stitch came out. I mean, not that they put a stitch in, but maybe, I think they surround the tube with a stitch, and maybe one of those came loose, because it was like a perfect hole, like obviously a tiny hole. And I wonder if that just made this area more sensitive, and that's why this area got more raised, because I know that scar tissue is when your body sends collagen to the area, so the more healing it thinks it needs, I guess, the more collagen it sends, and the collagen forms the scar tissue. So I wonder about that, but also I put vitamin E straight from the capsule, like slit the capsule with scissors or whatever, and then squeezed it on my finger and rubbed it on. And my doctor said that vitamin E was great for everything, including bacteria growth. So maybe that was it too, because I did end up right here having this, like, it felt like dry skin, and he said it was like a light fungal. He gave me something for it that I didn't like, so I ended up putting lemon juice on it, and that worked out. Anyway, maybe I should quit with the home therapies. But there's that. It's fine now. It's not that bad. I have like a little puckering here. It's also not that bad. I think I see it more than anyone else, but maybe that, I think that the best angle there, you can see it. That's the extent of it. And then my nipples, they are quite similar to one another. In fact, this nipple you can just see, like this point here and this point here. I don't think you really get that on this nipple, but they're both like, there's no actual nipple. I can see this skin that was once nipple, because I know what that skin sort of looked like, but it never actually formed the aesthetic of a nipple. But it is raised. It is raised a little in the middle. I think it's good enough. Honestly, that I'm fine about. But I will just say this: where these points are, where it was attached to, it really pulled. So it pulled kind of like this. In fact, even when it go that like this, I have a memory of it. And then like here, obviously you see that it doesn't change shape, and here it does. So I know it's quite common with this surgeon to get some real stretching there, and I think some people have even like lost nipples. So I feel like one of the reasons for that, actually I have no idea on the reason, I'm just guessing. I feel like it's really tight here to avoid what people call like dog ears, that kind of that triangular joint here. I feel like that's sort of the compensation, and I feel like with mine it started to come a little loose. It wasn't a problem in the end, but it started to come a little loose, and I feel like it might have been that I wore a tensor bandage instead of like a zippy uppy thing, or a thing designed for surgery. And I moved around a lot. I mean, I wasn't like jumping around, but I was walking, and just feel like maybe that friction. Anyway, if it's you, just like be willing to be bored, stay still as much as you can, and maybe like get something that's gonna, because I feel even with the bandages sort of on, that it's still, I don't know, that's my guess. So I would just say to just reduce that possibility to almost zero or whatever. Keep the bandages on. Anyway, if you want to see other stuff related to Belanger in my previous video, or to my care, I guess, then feel free to watch that one. But yeah, I just wanted to give you guys a visual on what it looked like 1 year on. Okay, thanks for listening. Hope you're all doing well. Take care.